Good morning, and thank you for agreeing to do this video. Could we please start by, if I ask you about who you are and what qualifications you have and your experience, please?
Hi, I'm Assistant Professor Prida Phunphapong. I'm an implantologist. I graduated from Chulalongkorn University in 1999, became a dentist here in Thailand. And after that, I worked for government for 2-3 years, and then went to US, United States of America, to study more in prosthodontics. And after that, did the implant fellowship program. And after that, in 2006, I became an assistant professor teaching at the University of North Carolina for the last 3 years in US. And then I came back in 2009 and working here since then.
Okay, thank you. Can you explain, please, what are implants and what are the different types, or what types would there be?
So the dental implant is the way to replace the missing tooth or missing teeth. Okay, what we do, we put the titanium screw into the bone and wait for the bone to grow to get integration. Implant becomes strong, and then we make the tooth or the crown onto the implant, and people can chew or function again.
Are there different types of implant?
For the implant treatment, normally can be categorized in 3 types. First, one tooth missing, and we just do single tooth implant. If it's a multiple teeth missing, we do a bridge, or it can be like the full jaw teeth missing, we do like the full arch implant restoration.
Oh, thank you. So, at what stage in someone's teeth deterioration or decay would you recommend an implant? Does the tooth have to be lost, or is it possible to take an existing tooth and remove and then implant?
Yeah, if the tooth get severely damaged, okay, by decay or by fracture, if it's not a lot of tooth structure left, we recommend people to get the tooth out, and sometimes we can place the implant at the same day. That's we call immediate placement. Sometimes if that tooth has infection or pus, we just have to wait, and we could wait 3 up to 6 months and then do the implant placement.
Okay. So what preparations would you advise a patient, an international patient, coming to Bangkok to make? By that I mean, do they need x-rays? Do they need the teeth already removed? Is that the sort of thing you would advise?
Yes, that would be a patient's benefit if they can send us the x-ray or the extraoral, intraoral photos, okay, and we can do the screening and look at the x-ray, and then email them back with the initial treatment plan. But final treatment plans still need to be done after actual oral exam.
Okay. And what is the procedure for implants? Because I know you mentioned earlier on about the bone and the titanium screw. Do you just literally screw the titanium in?
Yes. So the procedure, the steps, we get patient numb, fully numb, test it, and then we open small gum tissue and drill into the bone, and then place the implant inside that hole. And if patient doesn't have enough bone, we do bone graft, mostly the same time, and close the screw with the stitches.
Can you explain what a bone graft is? Because it sounds quite painful.
Right. In the case that the patient doesn't have enough bone, and implant need to be surrounded by the bone 360 degree. After we put implant in, if some part of the implant not inside the bone, we just have to build up the bone. And the bone that we usually use is the bottle bone from the company.
So you produce your own bone, it's not a piece of the person's bone taken from another part.
Sometimes we use that patient's bone, but most of the time we use the outside bone, the bovine bone. That can save time, save the second site surgery, okay, and people like that way.
Yes, thank you. So how long would a patient expect to be in Bangkok? If they came as a new patient, they were going to have an implant. And would there be more than one trip?
Yep. Normally it require 2 trips. Okay, the most would be 3 trips. Okay, and each trip require around 1 week most of the time. But sometimes patient has to stay up to 2 weeks if they need multiple implants or other dental work too. But about 1 week that's normally enough.
And then they come back and they'll be a week again for the second part?
Right, and then we wait about 3 months, 4 months. They come back second trip and they get teeth.
Nice.
Yeah.
And in between, do they get dentures, or do you produce a temporary bridge or something?
If it's front teeth, we give them the temporary denture, okay, or temporary fixed bridge. So patient can still smile, can still chewing, can still function.
Okay.
Yeah.
And once they've got implants and they've gone home, what aftercare procedure would you advise?
Yeah. We still recommend implant patient after we done everything. They still need to see local dentist or general dentist for teeth cleaning every 4 to 6 months. But if they could come back within a year or 2, we would like them to come back for recall appointment. So to make sure that everything is going well.
Can you explain the procedure for cleaning the different types of crown, the different types of implants available?
Yeah. Besides the cleaning by dentist, patient need to clean at home every day. And the way that they should do brushing, normal toothbrush in correct technique, and do dental floss in between. For the bridge or implant, they can use a super floss to clean underneath the middle tooth or the pontic. That way they don't have bad smell and teeth in good function, good and healthy gum.
And with the all-on fours, which is the full jaw,
Yeah.
they are cemented in?
No, they are, that's a screw retain. That can be removed and clean underneath, polish it, and even can be the acrylic material can be added, or porcelain can be added if the gum shrunk up. That can fill the gap.
Okay, thank you very much. That concludes the interview. Thank you.
Thank you.